What I'm about to explain today may genuinely save someone's life watching this video, because one of the biggest mistakes adults make before a heart attack is assuming the body always gives dramatic warning signs. People imagine someone collapsing suddenly, clutching their chest, unable to breathe, and yes, sometimes heart attacks happen that way. But very often, especially in adults over 50, the body begins whispering long before it starts screaming. A strange exhaustion that doesn't make sense. Tightness in the chest people dismiss as stress, shortness of breath while doing simple things, and unusual pressure in the neck, jaw, shoulders, or upper back. Nausea, dizziness, sweating, a sudden feeling that something just feels off. And because these symptoms don't always look dramatic, many people convince themselves it's anxiety, aging, exhaustion, indigestion, poor sleep, or simply getting older. But here's the frightening reality doctors see every single day. Sometimes the body is quietly trying to warn you that the heart is under stress long before a major cardiac event happens, and the earlier those warnings are recognized, the greater the chance of preventing something devastating. My name is Dr. Adam Scott Levin, and for more than 15 years, I've worked with adults dealing with cardiovascular disease, metabolic dysfunction, inflammation, high blood pressure, diabetes, stress-related health changes, and the subtle early patterns that often appear before serious heart problems develop. And today, I want to walk you through something incredibly important, what your body may be trying to tell you before a heart attack happens, why so many warning signs get ignored, which symptoms deserve calm medical attention, and why understanding your body early can sometimes change everything. Because this conversation is not about panic, it's about awareness, calm awareness. Before we go further, I want to ask you something. Have you ever experienced a symptom that made you stop and think, that doesn't feel normal? Maybe unusual fatigue, chest discomfort, dizziness, breathlessness, or a strange feeling you couldn't explain. And how old are you? Drop your age and experience in the comments below. Because one of the most powerful things about these conversations is helping people realize they're not alone in what they've experienced. Now let's begin with one of the most misunderstood warning signs of heart trouble: overwhelming fatigue. And I don't mean normal tiredness after a busy week. I'm talking about a deep, unusual exhaustion that feels disproportionate to what you've actually done. Many adults describe it as feeling drained for no clear reason. Everyday tasks suddenly feel heavier. Walking upstairs feels harder. Grocery shopping feels strangely exhausting. Some people say they feel like their energy disappeared overnight. This is especially important because fatigue is one of the most commonly overlooked symptoms before certain cardiac events, particularly in women. I remember one woman in her early 60s who came into clinic convinced she was simply burned out from stress and caregiving responsibilities. She kept saying, "I'm just tired all the time lately." But as we talked further, she admitted that even simple activities had started feeling unusually difficult. Carrying laundry, walking short distances, climbing stairs. There wasn't dramatic chest pain, there wasn't collapse, but testing later showed significant coronary artery disease. And honestly, stories like this are exactly why doctors pay attention to patterns, not just dramatic emergencies. Now here's where things become even more confusing. The heart doesn't always send pain exactly where people expect. Many adults think heart symptoms must happen directly in the center of the chest, but nerves connected to the heart can create sensations in the shoulders, jaw, neck, upper back, or arms. Sometimes it feels like pressure, sometimes heaviness, sometimes burning, sometimes tightness. Some people even mistake it for acid reflux or muscle strain. And because stress and anxiety can also create chest sensations, people often dismiss these symptoms for far too long. I remember a patient in his late 50s who repeatedly ignored pressure in his upper chest because it only happened during activity and disappeared with rest. He assumed it was indigestion from eating too quickly. Eventually, imaging revealed severe blockages in multiple coronary arteries. What shocked him most was that he never experienced the crushing chest pain he thought heart disease was supposed to cause. And that's something many people never hear clearly enough. Heart disease does not always look dramatic in the beginning. Sometimes the body whispers for months before it screams. Another symptom people frequently underestimate is shortness of breath, especially if it appears gradually. People adjust slowly without realizing it. They stop walking as far. They avoid stairs more often. They rest more during daily activities. And over time, reduced breathing capacity begins feeling normal. But the heart and lungs work extremely closely together. When the heart struggles to pump efficiently, the body may start compensating in subtle ways. I remember one man who thought he was simply getting older because he kept becoming winded while gardening. But eventually he realized something strange. He could no longer tolerate the same physical activity he handled easily the year before. That change mattered. And it's one reason doctors often ask not just whether symptoms exist, but whether your normal ability has changed over time. Because changes matter, patterns matter. The body changing without explanation matters. And one of the biggest dangers today is that people normalize symptoms slowly until the abnormal begins feeling ordinary. Now, here's something that surprises many people. Before a heart attack happens, the nervous system often becomes involved long before people realize the heart is under stress. That's why symptoms sometimes feel strangely emotional. Sudden anxiety, a sense of impending doom, sweating, shakiness, nausea, lightheadedness, restlessness, feeling mentally overwhelmed. And because these sensations overlap so heavily with panic attacks and stress responses, people often assume the problem must be psychological. In reality, the body's stress response systems become activated whenever the heart struggles to get enough oxygen. Adrenaline increases, stress hormones surge, the nervous system becomes hyper-alert, and what people interpret emotionally may actually begin physiologically. I remember one patient who repeatedly described episodes of sudden panic-like sensations at night, racing heartbeat, sweating, pressure in the chest. He thought anxiety was waking him from sleep, but further cardiac evaluation eventually revealed unstable angina caused by significant narrowing of coronary arteries. Once treatment stabilized blood flow to the heart, many of those terrifying nighttime episodes improved dramatically. Now, does that mean every panic attack is secretly a heart problem? Absolutely not. Anxiety disorders are very real and extremely common, but it does show how deeply emotional and physical symptoms can overlap inside the body. And honestly, that overlap is exactly why persistent or unexplained symptoms deserve proper evaluation rather than endless self-diagnosis online. Another warning sign many people overlook is dizziness or sudden weakness. The heart's job is to deliver oxygen-rich blood throughout the body, including the brain. When circulation becomes compromised, some people begin experiencing lightheadedness, instability, sudden sweating, or feelings of faintness. Again, stress alone can absolutely create similar sensations. But when symptoms repeat, worsen, or appear alongside exertion, doctors pay attention, especially in adults over 50 with risk factors like diabetes, smoking history, high blood pressure, obesity, elevated cholesterol, poor sleep, chronic stress, or family history of heart disease. Now let's talk about one of the biggest hidden drivers behind all of this: inflammation. Because modern cardiovascular disease is deeply tied to chronic inflammation, metabolic dysfunction, insulin resistance, poor sleep, stress overload, and sedentary lifestyle patterns. Many people imagine heart attacks happen suddenly out of nowhere, but in reality, heart disease often develops silently over years through damage happening gradually inside blood vessels. Inflammation contributes to plaque instability. High blood pressure strains arteries. Elevated blood sugar damages vessel walls. Poor sleep increases cortisol. Chronic stress amplifies inflammatory signaling. Smoking damages circulation. Lack of movement weakens cardiovascular resilience. And over time, the body accumulates biological stress in ways people cannot directly feel until symptoms finally emerge. This is why prevention matters so much. Not because fear helps. Fear usually makes health worse, but because awareness creates action. Better sleep, walking consistently, blood pressure management, blood sugar control, stress reduction, whole foods, social connection, regular medical checkups. These things sound simple, but biologically, they profoundly influence cardiovascular health over time. And honestly, one of the most dangerous myths in modern health culture is the belief that if someone looks healthy, they must be healthy internally. Doctors see very fit-looking people with severe heart disease. They see quiet symptoms ignored for years. They see adults who never thought anything serious could happen because they felt mostly fine. That's why paying attention to persistent changes matters so much more than waiting for catastrophe. And perhaps the most important thing I want people to understand today is this: the goal is not to live in fear of every symptom. The goal is to learn the difference between occasional discomfort and persistent, unexplained change. Because not every chest sensation is a heart attack. Not every episode of fatigue means severe disease. Not every dizzy spell is dangerous. But repeated changes deserve respect, especially when the body keeps trying to get your attention. The healthiest people are usually not the ones obsessively monitoring every sensation, and they're also not the people ignoring their body completely. They're the people willing to pay attention calmly, seek medical guidance when needed, and support their health consistently over time. That balance matters enormously, especially today, when so many people either panic over every symptom or ignore symptoms completely until something major happens. I remember one patient who told me something I've never forgotten. After eventually needing emergency cardiac treatment, he said, "Looking back, my body tried to warn me for almost a year. I just kept explaining it away." And honestly, that sentence stays with a lot of doctors because we hear versions of it constantly. The body often gives subtle signals long before major events occur. The challenge is that modern life teaches people to push through exhaustion, normalize stress, ignore sleep problems, and dismiss symptoms until functioning becomes impossible. But the heart doesn't care how busy life feels. Biology still matters. Recovery still matters. Sleep still matters, movement still matters, stress still matters, and perhaps one of the biggest hidden truths in medicine right now is that long-term health is often shaped less by dramatic decisions and more by consistent daily patterns repeated over years. So here's the final takeaway I truly want you to remember. If your body feels persistently different, if fatigue suddenly feels unusual, If chest pressure keeps returning, if breathing changes, if dizziness repeats, if activity tolerance drops, if something feels off in a way you can't explain, don't panic. But don't endlessly rationalize it away either. Talk to a qualified medical professional. Look at the full picture. Consider your risk factors. Pay attention calmly. Because sometimes the body is simply stressed. And sometimes the body is quietly asking for help before something more serious happens. The key is learning how to listen without fear, but also without denial. And honestly, that balance may save more lives than people realize.